Okay, Dad, tell us why we're here today.
We're here to yank out Jeffrey's wisdom teeth.
Hi, Jeffrey. How was it?
Oh.
Did you have fun?
Oh.
No.
What?
Joseph, what happened to you? What did you just go do?
I have no fucking idea where I am.
Did it feel bad? Did it hurt?
I don't remember a damn thing.
Does it feel bad now?
I feel great.
Well,
Whatever that did to me, right there,
right there?
that shit hurt.
Yeah.
But I don't remember a goddamn thing other than that.
Joseph.
What?
But you shouldn't talk like that. That's ugly.
Well, blame the medicine, not me.
Blame the who?
The medicine.
The manager.
The medicine.
Who's that?
I'm damn world first on 14.
Hi. I can't feel my face. It's not that big right now. But they took stuff. They gave me they gave me a lot of drugs, and my mommy bought me a milkshake. I told my sister that she's a very pretty flower.
Your mom take the reader? We're home, Jeff. Put the slinky down. Jeff,
Wait.
get out of the car.
Sit up. Sit up first. Come on. Put your head.
Oh, what the heck?
Just walk barefoot. We'll get them after. Walk barefoot. Jeff. Wait. Put your arm around my neck. Here. No. This arm. This arm. Okay, come on. We'll get your slippers after. Don't worry about it.
Where's your keys?
So, can I sleep?
Sure, go to sleep.
But they said I couldn't.
Why not?
They kept waking me up when I was sleeping.
Well, they want you to wake up because your anesthesia is wearing off.
I go back to sleep when I die?
No.
Then why can't I just get a few extra minutes of sleep before we actually left?
You can go to sleep. Sleep right now.
I don't trust you.
Why not?
You're a bad driver. And you shouldn't drive and sit and is that filthy beat or is that just
There's blood on your cheek
Oh. Like
and all over your cheeks. It's disgusting.
I feel like eating this all. There's no different. I got chocolate now. That's good stuff.
This little sweetheart right here
My fiance.
is going to get a peek at my little photo album.
You did all this while I was unconscious?
That's my favorite.
Crazy alert, and you thought she was a bad dentist? Marek Oshevsky had a nagging toothache, so he went to his dentist, who happened to be his recently scorned ex-girlfriend. What he thought would be a simple procedure by a trained professional turned into an absolute nightmare. Marek's ex, Anna Machowiak, drugged him, proceeded to pull every last one of his teeth, and then bandaged him up so he wouldn't notice. After he got home and the numbing drugs had worn off, Marek took off the bandages, looked in the mirror, and noticed a very empty mouth. He told a local newspaper, "I got home, I looked in the mirror, and I couldn't believe it. The expletive had emptied my mouth." And to make matters worse for Marek, his new girlfriend dumped him because she just couldn't be with a man with no teeth. So what's the lesson here? Well, a bad breakup can be like pulling teeth, literally.
After having an extraction, it's important not to smoke or drink any alcohol for at least 48 hours afterwards. This will stop any secondary infection happening. After you've had a tooth out, it's really important you just take the rest of the day quite easy. So it's a real good excuse to go home, just put your feet up on the sofa and relax.
I'm Mr. Chomper, and Supertooth has a message for you. You should brush your teeth 3 times a day for 2 minutes each time. That's 2 minutes in the morning before school, 2 minutes in the afternoon after school, and then 2 more minutes at night before you go to bed. But how do I measure 2 minutes? Well, I like to sing my favorite song, or say the alphabet 10 times. No matter how you measure it, just brush.
Captain Supertooth.
I get my patients really to avoid any heavy lifting. You're usually okay to drive home, get yourself comfortable. If it starts to bleed again, roll up a clean cotton handkerchief, bite really firmly on it, and sit down. Take about 15 or 20 minutes. Usually this will stop any bleeding. If you're getting excessive bleeding, please phone the dental practice for the emergency dentist telephone number and you'll get further instructions.
And anti-anxiety drugs. Even if you are afraid to visit the dentist, you can do a lot on your own to reduce the anxiety of a dental visit. It starts with choosing the right dentist. Find the dentist committed to helping you reduce your anxiety. Discuss your fears with your dentist and learn about the options for treating dental pain and anxiety. Then consider these tips. Avoid caffeinated beverages before your visit. They are likely to make you more anxious. Schedule your appointment for early in the day and try to get a good night's sleep beforehand. Bring a friend or family member for reassurance. Bring along a portable music player with headphones used as a distraction before and during treatment. Practice relaxation exercises. Have your dentist agree to a stop signal so you can take a time out from
Oh, there's lots of reasons why I decided to become a dentist. I saw a lot of dentists when I was younger and I wanted to use my experience to help other people. I like the tools I get to use. I was also impressed by the variety of things a dentist can do. Well, a dentist does a lot of things. Dentists work on prevention of dental problems and public education. We diagnose and manage oral conditions. We correct and restore teeth and gums, not only so people can have nice smiles, but also to prevent further problems like pain, infections, or even malnutrition. Some dentists become specialties in areas like orthodontics, periodontics, or prosthodontics. Some even become oral surgeons. No, you don't all have
The procedure if you need to. Most importantly, get regular dental checkups. Routine dental visits help in several ways with reducing anxiety. First, you can build a good rapport with your dentist. Second, you become familiar with the dental staff and office. Finally, your dentist can catch problems early, avoiding more expensive and potentially painful procedures later on. Keep these tips in mind and take the stress out of your next visit to the dentist.
I've often said to my own children, we see what we look for. You ever gone into a room and you've looked for something and it wasn't where you thought it was, and so you leave, and then 20 minutes later you find it was right next to something else? That's because we weren't looking for it there. Well, I feel for this mother here who says, I hate going to the dentist. So of course her whole attitude, the whole thing that she is looking at, is that she hates going to the dentist. So I don't think my child will like it either. Okay. Why scare him at such a young age? Because we're talking about coming in so early. I'd like to reverse that around and hope that that mother can see something new from this whole program we've talked about. But I'll put that question over to you because I think I know your answer already. Why take him at such a young age?
So the reason why the mother was probably scared of the dentist or hates the dentist is the same reason why she has to take her child to the dentist at the young age, to prevent the child from hating the dentist.
Right.
Normally people who hate the dentist is because they had a bad experience.
And they started so late and there was a problem and we had to drill and we had to pull or we had to, yes.
Yeah, for sure. And that's why we get those nightmare stories, right? And we want to teach people that prevention is so much easier, so much pleasant, less expensive, and it's really the way to prevent transferring that fear of the dentist to their children. So even though you had a bad experience and you're reluctant to go yourself, right? So you may transfer that fear onto your kid and say, I don't want my kid to go through that. But the same reason, if you take your child on a regular basis and we detect small things and they're fixed without the needle, without numbing, without pain, it's pleasant, it doesn't cost too much, and that way it becomes pleasant for your child. And perhaps for yourself, if you can see that, you know what, if you're already on the good path for good dental health, then things are pretty good and they're not that bad, and perhaps you can change your own mindset about it. But if, let's say, you're unable to change, at least give your child that chance to experience the good side of dentistry. So it doesn't have to be negative whatsoever. Yes,
let's turn this completely around, because I know for my daughter, my younger daughter, she was afraid of dogs most of her life because mom reacted to a dog once coming up when my daughter was real young. We then happened to be trick-or-treating one time. We, of course, cleaned her teeth very well after the trick-or-treating, Dr. Long. And she met this dog from a neighbor, and she just loved the dog, and she loved dogs from then on. Because that woman's horizon expanded it for my daughter, she could now see how to love the dog. So I, as a dad, not as the dentist, but as the dad, plead with the mother who gave us this question to say, listen, go early on so that the good set of habits, the good horizon, can be seen.
So as parents, we have that power to break that legacy, so it doesn't have to be that way. So
let's go the good way.
Absolutely. And Dr. Julia, I mean, it just occurs to me sitting here, and I can't help it because I'm a psychologist, that there's a whole other layer to this whole prevention program. By bringing these children in with their moms early, setting all these good habits, you're actually preventing a kind of self-fulfilling prophecy about what may have been bad experiences that someone else had, growing up, because they didn't have the kind of program offered to them that you're offering to your community, where you're setting these good habits. So you're actually preventing the next generation from having, preconceived notions that dentistry is a painful thing that I have to fear.
And it doesn't have to be, because if you have the tools and the knowledge and you know what to do to keep your teeth healthy, then you'll never have to experience like negative appointments at the dentist. So that's why it's so important to see those children early on and teach those children early on that, you know, dentistry, it's not scary, and it doesn't have to be scary, and it's fun, and it's just about taking care of your teeth so you can be healthy as well.
And what's awesome about that too is that in the process of doing that, you may actually break that pattern for the mom or the dad, or you know, that for their bad experience, because they're seeing that it doesn't have to be that way.
Yes, hopefully for them as well, because the more they fear, again, is the more they will tend to neglect the dental health.
They'll postpone,
and
yeah.
the more they postpone, then the more you know, complication may
things get more
yes.
advanced by the time they come in. Yeah.
So I had a dentist appointment today. And therefore I spent my morning as any sensible adult human being would do, eating a giant piece of cake for breakfast and then brushing my teeth as vigorously as possible, as if brushing my teeth like that could wash away the sins of the past 14 years in which I've not gotten any dental care. My appointment started at about 11 o'clock in the morning, and so I got there, filled out some paperwork, and then they took me back to a little room where they told me to open my mouth as wide as possible. They gave me those safety glasses as if an x-ray was going to fly at my eyeballs and poke them out or something. I didn't quite understand that. Anyway, the appointment went pretty well. I don't have any cavities, but I do have some impacted wisdom teeth that are growing perpendicular to the rest of my teeth. But really, what my day got me thinking about was that brushing of the teeth that I did this morning. And it got me thinking about crisis and how we respond to crisis. Take, for instance, the crisis that's happening currently in Japan. We responded immediately to the tsunami and earthquake with aid, but many of us were motivated simply by the crisis. Now, of course, Japan, being a first world country, doesn't typically need our aid. However, there are plenty of other countries that do require our aid on a constant basis. They require us to brush our teeth every day, and perhaps floss every once in a while. Anyway, it got me thinking about the fact that brushing my teeth is an action, rather than an emotional response. It's a duty to take care of my teeth, as I also believe that it's a duty for me to take care of my fellow man. Don't be motivated by crisis. Don't be motivated by the fact that you have to go to the dentist this morning to brush your teeth. Instead, be motivated by the idea that if you don't regularly care for your fellow human being, your teeth, they're going to fall out, and that's just not going to be good.
How old do you think children should be for their first visit to the dentist? Most Americans wait until their child is at least 3. That's 2 years too late, according to the American Academy of Pediatric Dentistry. They recommend that a child go to the dentist when the first tooth comes in, usually between 6 and 12 months of age, and no later than age 1. This visit will establish a dental home for your child. Early examination and preventive care will protect your child's smile now and in the future. Scheduling the first appointment at such a young age is a great way to catch oral health problems early and to help the child get acquainted with a pediatric dentist and dental office. The dental visit can be with a pediatric or general dentist. Many dentists allow young children to sit on their parents' laps during exams. They also may offer rewards such as stickers and toothbrushes afterward. Another important purpose of the visit is to watch for and prevent early signs of decay or cavities in young children. Even baby teeth are at risk for decay. Your dentist can provide information about how to protect your child's teeth, and the earlier the dental visit, the better the chance of preventing dental problems. Children with healthy teeth chew food easily and smile with confidence. Start your child now on a lifetime of good dental habits. As parents, you can do a lot to make the first visit to the dentist a comfortable one for your child. This will be a new experience for your child, so you can help him to expect it to be a positive one. Tell the child what to expect. The dentist will count your teeth and brush them to make them clean and shiny. Avoid phrases like "be brave" or "don't be afraid." Don't bribe the child with special treats. If you're positive and reassuring, the child will expect the visit to be fun. The appointment should last between 15 and 30 minutes. During that time, the dentist will conduct a gentle but comprehensive examination of your child's teeth, gums, jaws, and bite. Depending on your child's age and degree of cooperation, the dentist or hygienist may clean and polish your child's teeth and apply a topical fluoride. The dentist or hygienist also will demonstrate proper toothbrushing and flossing techniques, discuss a protective diet and snacking practices, discuss thumb sucking and pacifier use, and address the use of topical fluoride. Remember that tooth decay is nearly 100% preventable, so it's important to begin good oral health habits like visiting the dentist